The most important thing about filler is that a lot of times patients come in with a concept that they want, this area, kind of filled. And they're really looking at a lot of times lines or hollow regions. But what we should do as clinicians is to assess the patient globally and create a face that is proportional, homogeneous, and providing the shape the patient is looking for. So probably the most important thing about assessment, and there's two ways of really approaching this. We can do what's known as outside in or inside out. And outside in means assessing the patient clinically in terms of how they look, and we work our way inside. The other way is, when we say inside out, is the anatomical features. So providing bony framework, followed by soft tissue enhancement, and then structural support, especially in the middle of the face. And when we say outside, we are talking about, first, creating facial shape. The most commonly asked for shape is an inverted X shape, where the top portion of the face is a little bit more curvaceous. In the lower part, it's a little bit more accentuated. A lot of people do have hollowness in what we call the temple area. Filling this area makes everything a little bit smoother, but also minimizes the enhancement of the cheekbone. The other area for her is the mid portion of the forehead. The top portion of the forehead looks pretty curvaceous, but from midpoint on to the eyebrow, it's a little bit hollow. And a lot of times we do want that forehead to be nice and smooth. A lot of people, we do lose sort of volume in what we call the submalar space. Make the cheekbone less prominent, creating that smoother contour. Although the cheekbone, which is kind of more towards the side, is prominent, inner portion or the mid-face region looks flat and hollow. The other thing that a lot of people have is obviously the chin. By bringing the chin point a little bit more forward, it really does help to kind of define the jawline definition better. These days, we never want to make the chin too pointy, okay? We still want some roundness to it, but it will create a better definition and shape. So that kind of concludes the periphery, okay, or the outer circle of the face. Is by providing more support, we can create the facial shape that we usually want. For most people, it is about that inverted X shape. I kind of skipped ahead and I talked about the mid-face region, which is part of the inner circle. And part of the inner circle that we usually talk about is from eyebrow to the lip region. In some people, we actually do want to fill in an area that is just below the eyebrow. By enhancing the eyebrow definition, we can create a little bit more of a defined structure to the face. The lower lip should be a little bit thicker than the upper, and the corner of your mouth does kind of droop down a little bit. Kind of gives you a little bit of a lift to the corner of the mouth so that it doesn't look down. For people who have a little bit more of that upper lip bone that kind of sticks out, even when you're young, your smile line looks deep, okay? Because it's not about sagginess, but it's more about cheekbone to upper lip connection. And so filling in this area, I think, will bring a little bit more smoothness to your face. And then it is about the nose. When people have hump like this, okay, what tends to happen is that it makes the tip look like it's really droopy. So obviously, like with non-surgical method, what we can do is, we can't really shave off the hump, but what we can do is we can fill in slightly above and slightly below to kind of make that entire dorsum like more straighter, and then fill in the tip a little so that it kind of gives you a little bit more projection and slightly lift.